Consumers are paying more for everything, from eggs to energy costs to prescription medications. There are several federally funded programs that can help defray some of these expenses, yet they go unused year after year. A recent study found that while nearly 26 million older adults were eligible for supplemental nutrition assistance, AARP found 63% did not take advantage of the benefit.
Hello, everyone. Welcome to this month's edition of Rural America Live with AARP. I'm Christina Loren. Older adults, without ever realizing it, are actually leaving billions of dollars in government aid on the table each year, money that could actually help pay for utilities, rent, prescription drugs, groceries, and more. Tonight, our friends from AARP are armed with incredibly valuable information about programs that are available to help those in need. And we have a benefits expert here to answer your questions about how you can access these programs. And you're a big part of this show. We want to hear from you tonight. Give us a call at 877-283-7570. And you could be a winner. Our question of the month is, what benefits and services are important to you and your family? Think about that for a moment and then let us know. You could be a winner. Like I said, we're giving away a cooler to 5 lucky on-air callers. Pick up the phone, join our conversation. We're going to open up those phone lines for you now, 877-283-7570. And we really want to spend some time focusing on Social Security and particularly Medicare tonight. Most of the questions that we get tonight are going to be about Medicare because 'tis the season. Open enrollment started this week, goes through December 7th, and we know you have a lot of questions. Now remember, you don't need to be a member of AARP or over the age of 50 to win, but as a friendly reminder, you can only win one time each calendar year. So give us a call and join that conversation, 877-283-7570. If you are a winner tonight, AARP will call you back in the next few days to confirm your mailing address, so make sure to return their call. Now, let's welcome our friends from AARP. Joining us tonight, Brad Anderson, Director of AARP Iowa, and Kathy McClear, welcoming back, the Director of AARP Minnesota. We're so happy you're with us tonight.
It's great to be here.
It's an important topic. When I saw that we were going to be doing a show on benefits, I wasn't quite sure what we were going to focus in on, but then I took a deeper dive and found that there are some great options available out there, especially right now with inflationary pressure. We're concerned about interest rates. The timing could not be better. So, Kathy, let's start there and talk about the recent Social Security announcement.
Yeah, so just last week, Social Security announced the cost of living increase for 2024. So as folks might recall, 2023, the Social Security recipients saw a very large increase. This year, not quite so much. So in 2024, that cost of living increase, the COLA, will be 3.2%. And that means that the average, starting in January, the average Social Security retirement benefit will go up about $59. But so is the Medicare Part B premium. That's going up about $10. So most Medicare beneficiaries they'll be paying about $174 for their Medicare Part B starting in January.
So they're going to get a little bump, not as big as the bump that we saw last time when we were adjusted for COLA, but they are going to see that money going into another direction. So it's basically being funneled from one pocket to another.
Yeah, so they'll still see the net increase will be about $50. So it's still going up, but so is the Medicare premium.
Okay. Well, I think some people are just happy to see the two cost of living adjustments back to back. I know I was. I was actually a little bit surprised to see that. Brad, tell us about some of the benefits that are underused by millions of older Americans that could actually help out, particularly right now.
Well, thanks, Christina. So one thing we don't want to do is leave money on the table. So we're going to talk to our viewers tonight and let them know about benefits that could save them a lot of money. And there are 4 benefits I want to talk about right out of the gate. The first benefit you mentioned at the top of the hour, top of the show, and SNAP, which stands for Supplemental Nutrition Assistance Program. And this is a monthly benefit that helps pay for groceries at the supermarket and farmers market. Nearly 26 million adults 50 and older were eligible for this program in 2018. However, as you mentioned, we found that 63% of those eligible did not take advantage of this benefit. Again, they're leaving money on the table. We want to avoid that. Let's move to number 2 now. And this is healthcare. And so there are Medicare savings programs out there that help eligible older adults pay for Medicare Part A and Part B deductibles, co-insurance, and co-payments. So they pay for a lot of things. Older adults can save more than $2,000 per year through this program, yet more than 3 million eligible adults 65 and older are not enrolled. They are leaving billions of dollars of available benefits unused and on the table. This next one is even crazier, okay? So this is prescription drugs. We're talking about billions left on the table here. So this is a program called Extra Help. And Extra Help can cover monthly premiums, annual deductibles, and co-payments for Medicare prescription drug coverage. Extra Help is worth around $5,100 per year for eligible participants, yet we found $7.6 billion a year goes unused. This is one of those programs that I encourage everybody, if you may think that you're eligible for it, absolutely look it up. You could save big time money through Extra Help. And so the final example I want to offer, final benefit, is LIHEAP. And we've talked about LIHEAP a lot on this show. This is the Low Income Energy Assistance Program. This is where recipients get a one-time payment to help with winter heating costs coming up this winter. A payment can be as high as $1,400.
Wow.
Although the average payment is about $500. So check if you're eligible for LIHEAP. And here's the deal. We have a lot of audience members who could be saving thousands of dollars, and you're probably wondering, well, Brad, how do I learn how to access all these great programs? The answer is AARP Live. So we have www.aarp.org/AARP Live, and we will offer links to all these programs, and then you can check your eligibility.
I love that. And so as you're watching tonight, if you happen to miss something, because we are going to be talking about a complex topic. I mean, I don't know that there's anybody out there except for maybe our special guest tonight who knows everything about Medicare, but that's why he's going to be joining us. Ryan Ramsey will be here on the other side of this break. He's the Deputy Director for Tennessee Commission on Aging and Disability, and he's here to take your questions directly. So we are going to fire up those phone lines right now, pausing for a quick break. It's your time to call in, 877-283-7570. Before we get to your questions and bring in our financial expert, we have some great information about assistance that could be available to you if you are eligible for Medicare. Join the conversation tonight. You might be a winner. We've got coolers to give away in just moments. 877-283-7570. We want to hear from you tonight. We'll be right back.
I can't afford Medicare. Is there any financial help available?
Yes. Medicare beneficiaries who are also on Medicaid get some or all of their out-of-pocket costs covered. Medicaid is a joint federal and state program that helps some people with limited incomes get their medical care. More than 12.3 million people are what the federal government calls dual eligible.
How do I qualify to become dual eligible?
Each state has its own Medicaid program. It needs to follow federal guidelines, but each state gets to set eligibility standards and what it covers. You'll need to contact the program in your state to see if you meet its qualifications, including its income threshold.
What if I don't qualify for Medicaid but still need financial help?
Medicare has 4 savings programs: Qualified Medicare Beneficiary, Specified Low-Income Medicare Beneficiary, Qualifying Individual, or Qualified Disabled and Working Individuals. These programs can help pay for Part A and Part B premiums and other out-of-pocket costs like deductibles, co-pays, and other charges. Which program you qualify for will depend on your income. Check with your state's Medicaid office to see if you qualify for any of these programs.
What about prescription drugs?
The Extra Help program assists people with limited resources in paying for Part D prescription drug plan premiums, deductibles, and co-pays.
How do I get extra help?
If you qualify for the Qualified Medicare Beneficiary or the Specified Low-Income Medicare Beneficiary program, you automatically can enroll in Extra Help. You can apply through the Social Security Administration. To learn more, go to aarp.org/Medicare.
Welcome back to Rural America Live with AARP. Medicare Parts A and B, veterans benefits, prescription drug coverage, supplemental coverage, navigating benefits. It can be complex, confusing. That's why our friends from AARP are here to help us out tonight. And they brought a special guest to answer your benefit questions head on. We also have 5 coolers to give away, and you could be a winner. Pick up the phone. The lines are open, 877-283-7570. If you are a winner, AARP will cover the shipping, and these are high quality coolers. You definitely want to win one. I know that. 877-283-7570 is the number to call. And joining us once again, Kathy McClear from AARP Minnesota, Brad Anderson from AARP Iowa. And now we welcome our special guest, Ryan Ramsey, the Deputy Director for Aging and Disability for the state of Tennessee. Welcome to the show.
Thank you for having me.
You are really important right now, sir. As we know, this is a big week, open enrollment for Medicare this week. It goes through December 7th. We want to help our viewers understand more about the benefits that are available to them. You've been involved in this arena for a long time. Based on your experience, last decade of experience, as I understand it, have you seen a recent change in the needs of people, older Americans, when it comes to Medicare coverage?
Medicare coverage is going to be very important for all elderly people, and being able to make the most informed choices when it comes to your Medicare is going to be incredibly important. The majority of people don't have to focus on Medicare until they get right up on it. And really what we need to be doing is informing people ahead of time and enabling them to make those choices that are not only going to be the most the most effective for them cost-wise, but also that are going to cover them the best. The program that I work for, Tennessee SHIP, that's the State Health Insurance Assistance Program, and there is a a SHIP program in every state and 4 territories within the United States. Does exactly that. They offer free, unbiased assistance for Medicare to make sure that people can make the choices that not only cover their needs the best, but are also the most cost-effective.
It's not a one-size-fit-all operation by any means. Everybody's going to have different needs, different desires as they're trying to make these important decisions that are long-standing. This is not something that you're able to get out of once you make those final decisions. For a while, you're probably going to have to wait some time. Tell me a little bit about what the changes that we really need to know about going into this new enrollment season are.
Oh, fantastic. Well, the Inflation Reduction Act took effect earlier this year. One of the things that did was put a insulin copay monthly cap of $35 on all insulin products. Like we discussed, the monthly premium for next year is going up about $10 to $174.70. Your Part B deductible is going up to $240. That is a $14 increase at that point. Beginning in 2024, with those extra help benefits, there will no longer be a partial program for extra help. Anyone who meets that 150% federal poverty limit will be able to get extra help. Those levels and how much you will need to make will come out in early 2024. Beginning in 2024, the 5% prescription cost sharing obligation for Part D plans will take effect for catastrophic coverage. That will be removed. So once you pay around $3,100, you will no longer need to pay for that catastrophic coverage. All of your medications will be free at that point. In 2025, the annual limit of $2,000 for prescription drug costs for Part D will take effect. Meaning no one with Medicare insurance will spend more than $2,000 a year for their prescriptions at that point.
Wow.
Yeah, I think that's something really important to point out is, the dreaded donut hole. So
Right.
when folks would fall into that donut hole, they would have to pay exorbitant prices until they hit that catastrophic coverage. And so getting rid of the donut hole is a huge issue, and AARP fought very hard for that.
And AARP also fought very hard for the insulin reduction.
Absolutely.
I mean, huge. It's helping people, so many people in this country. That's wonderful news to hear. Tell us about tips. We're looking for tips tonight because everything that you just said, if you're like me, you heard some of it. You're still trying to figure out other parts of it. What tips do you have as we're trying to make these key decisions right now, as we're going into the enrollment period? What should we keep in mind?
What I should inform everybody that you need to keep in mind is that there is no best plan. A lot of people out there will tell you, I offer the best plan or I have the best plan. There is a best plan for your particular needs. When I do comparisons, even for two spouses, what's best for one person is not what's best for the other person because they have different needs. So go to somebody, call your SHIP. I will always shout out SHIP when it comes to advice for how to handle Medicare and get free unbiased assistance. You need to go and get a comparison of your prescription drug plans every single year.
And you brought up a great point. Sometimes this is not going to be individualized. You've got to think about your spouse as well. Incredibly important. Okay, we're going to go to our first winner tonight, William of Mississippi. Congratulations to you. Go right ahead with your question.
Well, thank you very much. Y'all are very informative, and I appreciate it. My question, my wife and I are both 75. We both have A and B, and we're inquiring. I'd like to know information concerning D. I heard some of it, but I didn't get all of it. And also, what is this advantage, Medicare Advantage, that we keep getting bombarded with?
That's a great question, William. So when you first become eligible for Medicare, you essentially have two options. You can go with Original Medicare and take that route, or Medicare Advantage. With Original Medicare, you have the option to pick up not only a prescription drug plan, which will cover all of your prescription needs, but also a supplemental policy, which would cover your inpatient and outpatient, your hospital and doctor coverage as well. The other option is Medicare Advantage. What Medicare Advantage does is group that hospital, doctor, and prescription drug plan all under one plan. For an answer as to which route is the right way, that is something that if you call one of the SHIP coordinators and they can walk you through what your needs are. Do you travel a lot? Do you stay in the same location a lot? Do you have a lot of doctors that you need to be within the same network? A lot of those factors are going to be very important in deciding, do I want to go with a Medicare Advantage plan or do I want to stay with Original Medicare?
Okay.
And that decision, by the way, is a really important one. So once you're eligible for Medicare, making that decision is really important. So what they say, what I've heard from other SHIP counselors, is basically you marry your Medicare plan and you date your prescription drug plan.
Absolutely.
So you can consider a new prescription drug plan every year. And again, just calling SHIP, and because you have worked for SHIP, you can't tout it as much as I can. I can tell you, just calling SHIP can literally save you hundreds, if not thousands of dollars on your Part D plan, because they will offer guidance on which one is the best fit for you.
I love it.
And to Brad's point about reviewing your plan every year, even if you have a Part D plan, a prescription drug plan that you really like and it's been treating you very well, what I always tell people, it's the 3 C's. It's cost, it's coverage, and it's convenience. Because if you start taking new medications, you need to make sure that Part D plan covers what you need to take. And if you've moved to a new neighborhood or you've moved to a different state, is that pharmacy going to be included on your plan, or do they have a mail order plan that's going to save you additional dollars? So it's really important, even if you like your plan and it's been serving you well, take this opportunity to review it, because it might not fit for you anymore and it might be just fine. So it's really important to review every year.
Absolutely. And you keep touting SHIP. How can people get into contact with their local SHIP office?
Well, every state has a local SHIP office, but what is the general phone number if you want to reach out to SHIP?
Well,
Ryan?
We're always happy to point everybody to the SHIP department within their state as well. But if you call Tennessee SHIP, that's 1-877-801-0044. And we're happy to connect anybody with a SHIP representative in one of our brother or sister states.
I love that.
I should have that memorized.
You gotta love Tennessee.
And it's important to note that it's not SHIP in every state.
Correct.
Some states have SHINE, Senior Health Insurance Information Network. Yeah.
Okay. A good place to start would be aarp.org/AARP Live as well, if you're looking for links. Okay, we're going to go to Nebraska, where Mac joins us tonight. Thanks for joining us, Mac. What's on your mind?
Yes, ma'am. How y'all doing tonight?
Pretty
Very
good.
well, Matt.
My question is, I think people would use the auxiliary program if they knew how to get in touch with them. Such program as the SNAP program and the utility program. How do you get in touch with those auxiliary programs that you guys offer for Medicare recipients.
Well, Mac, one of the wonderful things about the SHIP program is that many SHIPs across the nation do partner or receive a grant from the Administration on Community Living for assistance on low-income programs. It's through the MIPA grant, which is Measured Improvements for Patient Participation Act. What they do is they pay that grant for us to be able to, in addition to offering Medicare assistance, to help people connect with the Social Security Administration, their Medicaid office, to apply for those particular programs. And many of them also work very closely with a SNAP coordinator within their offices. So what I would recommend is calling that Medicare office and allowing us to connect you with those people to get help with those programs.
And Brad, you have another way that we can connect as well.
Yeah, so let's get this graphic up, the benefitscheckup.org, because one of the nice things is all you have to do is put in your zip code if you go to www.benefitscheckup.org, and you can find all, so Mac was asking, how do I get in touch with SNAP? How do I get in touch with LIHEAP? You know, so all the benefits that you could be eligible for, you can check that eligibility on this great website. And so this website has been a lifesaver for people in Iowa. I recommend it all the time, and it is a real easy way to check that eligibility. The one other thing I would say is, again, going back to our AARP Live website, we do have those links up there directly as of now, as of the show running. So again, that's www.aarp.org/AARP Live.
It's all right there, a one-stop shop, so you can actually go through program by program by program to see what you're eligible for. I love how you lay that out for people. And just to give you an idea, you brought the Medicare Bible with you.
That's
Show
right.
everybody at home how thick that thing is.
That thing is.
The benefit of having Ryan on the show with us tonight is that you don't have to read the Bible. You can just, well, you should read your Bible, the Medicare Bible. You don't have to read through that to get your answers. You can call and get them directly answered tonight. The number is 877-283-7570. We want to hear from you tonight. We're going back to the phones, and we have our next winner joining us. It's Dot from Virginia. Thanks for joining us, Dot. Go right ahead. Congratulations.
Thank you. I receive every so often the update from Medicare on how about your deductibles and such. And I don't really look at it, but I happened to catch something about the deductible, which did not apply. I found on this there were 5 on one paper and 1 a year ago where the scammers had sent Medicare bills for $100 each for the COVID test, and Medicare had paid them $84 plus cents. I called Medicare, and it was a scam. He removed it from my paper and away from my name, but he said that people weren't alerted checking into that, and all I'm saying is check your paperwork that comes in the mail more often.
Yeah, that is great advice from Dot, because there is fraud, unfortunately, in Medicare, and especially during this open enrollment period. So if someone calls you or emails you saying, if you pay me this money, I can help you find the best plan. Do not pay anyone to help you find the best Medicare plan or your best Part D plan. That's a scam. So you should check your Medicare statement every month to make sure that the charges that have been charged to your Medicare account are in fact correct. And we have a lot more information, of course. We've talked about it on this show before, the Fraud Watch Network, the AARP Fraud Watch Network. That's a great place to get resources as well. But Dot had a great point that you do need to check that statement, and open enrollment is just rampant for scammers. So make sure, if you're not sure who you're dealing with, hang up the phone and call your local SHIP, and they can get you pointed in the right direction.
Absolutely. Great advice there. Okay, and congratulations again, Dot. We're glad you called in tonight. David from Minnesota joins us next. Thanks for joining us, David. Go right ahead.
I was wondering if there's anything covers dental work, eyewear, and hearing aids.
David, the dental, vision, and hearing is not covered under original Medicare. If you wanted to attain those benefits for dental, vision, or hearing, you would need to sign up with a Medicare Advantage program. Those do offer additional benefits that include dental, vision, and hearing. Perhaps not 3 on all of them, but if you check with each one of those plans, you will be able to determine which of those benefits they offer.
Now, we'd like to point out that AARP would like to change that, by the way. So in the advocacy arm of AARP, we do talk to members of Congress a lot and talk to them about the importance of dental and hearing and eye coverage, because I don't think those are nice to haves. Those are need to haves. And so, but we've been working, of course, on the prescription drug. As you know, we've been on the show. We've been working on lowering prescription drug costs. So it's time to maybe pivot the advocacy a little towards what David just mentioned.
Absolutely. You think about the potential implications of gum disease, how critically important it is to take care of your teeth. So I'm glad AARP is doing that. Thank you for doing that, AARP. Okay, we're going back to the phones. Actually, our caller doesn't want to go on live television. That's okay. If you want to just convey your message, we will get it out there. And they're wondering about designating survivor benefits from Medicare. Is that a possibility?
No.
Okay.
No.
Okay, Social Security is a different story.
Correct.
Okay, good to know, good to know. I want to make sure you have the number to call in tonight, 877-283-7570. Unfortunately, as we know right now, inflation pressure is high. It's hard for a lot of people out there. What if you find yourself in a situation where you can't afford your Medicare premiums? Are there any options?
What I would recommend is you can contact the SHIP department, of course, to try and get an application in for a Medicare savings program or for the Extra Help program. But aside from that, those are really the only things you can do. I would also recommend doing a plan comparison to make sure that you're finding the plan that covers your prescriptions and also is going to cost you the least as well. If I had a nickel for every time I talked to somebody who was paying much more than what they needed to when I did a plan comparison for them, I'd be able to retire very early.
And cover your premiums.
That's right. That's right.
And Kathy, you are the spouse of a veteran.
I am.
And you know about veteran benefits that are really important.
Yeah, it is really important for veterans to understand what benefits are available to them. And AARP also has a Veterans Health Benefit Navigator. And so what that does is provides information on how to find benefits around women's health care, from that to how to qualify for disability-related benefits, just a slew of benefits that are available to our service members, retired service members and their families. So you can go to aarp.org/veterans, or of course you can go to aarp.org/AARP-live for all of that information as well.
Excellent. Okay, we're going to go back to the phones in just a moment. 877-283-7570 is the number to call. I think some people are under the misconception that once they turn 65, they're automatically enrolled. What would you say to somebody of that mindset?
If you're currently receiving Social Security benefits, you're correct. You will be automatically enrolled. If not, what I would do is I always recommend contacting the Social Security Administration 3 months prior to you turning 65. It's always a good practice to make sure, even if you are deciding to delay enrolling into Medicare, which you can do, as long as you're still working and still receiving insurance through your employer, you can delay Medicare as long as you need to. But I always contact 3 months ahead just to make sure that Social Security understands what I want to do with my Medicare benefits prior to starting on Medicare.
Okay, excellent. We are going to go back to the phones where we find our next winner in Oklahoma tonight. It's Thomas joining us. Thanks for joining us, Thomas. Congratulations to you. What's on your mind?
Thank you, Christina. All right, I'm a veteran, and I did 18 years, and my health care is paid for. So do I really need Medicare? Can I cancel that at the beginning of the year? And secondly, like Social Security I put into it, can I take those monies that I didn't spend in Medicare? Can I have them repay me what I put in that I don't want to use anymore? And then Canada has almost a free health care. Why don't we have that here?
Well, Thomas, I cannot speak to what goes on in Canada, as I'm not an expert in anything to do with their healthcare system. But what I can tell you is if you are receiving veterans benefits, you may not necessarily need Medicare, but you do run the risk of, if you do not take Medicare benefits and you do choose to take them later on, of paying a late enrollment penalty. My suggestion for anybody who may be in that situation where it comes to, I may not need to utilize my Medicare benefits, but I do not want to take the risk of perhaps incurring late penalties later on in life, is to try and talk to somebody to do a comparison to find out which plan may cost them the least overall for the year, so they do have that coverage, and make sure that they avoid any sort of late enrollment penalties.
That's good advice.
Absolutely. Okay, Thomas, thank you for that, and congratulations to you. That leaves a line open for you to call in tonight, 877-283-7570. We're going back to the phones. Nancy joins us now. Thank you so much for joining us tonight, Nancy. Go right ahead.
Are you calling Nancy from North Carolina?
Oh, we want to talk to you, Nancy from North Carolina. You are on with our Medicare experts.
Well, my question is about the shingles shot. Because I do not have the Part D medical, the prescription part, I understand if I want to get the shingles shot, I have to pay the $400 for the 2 shots. AARP came out in one of their newsletter papers and said that in 2024 that it would be covered. Well, when I talked to my pharmacist, he said, no, I don't think it's going to be covered. So I really need the shingle shot because I had it last fall, but I don't have the $400 that I feel I want to pay for it. So I guess will Medicare cover it without the Part D coverage or not?
Well, Nancy, that's a great question, and that was part of the Inflation Reduction Act that AARP fought very hard for, to get some of those preventive immunizations covered. Perhaps Ryan can tell us which part of Medicare pays for that.
Unfortunately, Miss Nancy, the prescription drug coverage does cover those vaccinations right there, so you would need to have Part D and able to have those covered.
Ethelyn joins us now from Kansas. Thank you for that call. We sure appreciate it, Kathy. Ethelyn from Kansas is on the line. Thanks for joining us. Go right ahead with your question. Ethelyn, can you hear me?
What benefits will I lose by taking Advantage Part C when I just have A and B?
Well, you would not necessarily lose any benefits. What you would do if you only have Parts A and B is that you would gain prescription drug coverage in most cases. There are some Advantage plans that do not offer drug coverage, but those are becoming few and far between at this point. What you may perhaps lose out on is the ability to pick up a Medicare supplemental policy or a Medigap policy. In that case, the best time to purchase one of those is when you're first eligible for Medicare. You have a 6-month guaranteed issue rights period where you cannot be turned down and are not subject to underwriting. So that is what you may lose in terms of benefits by going with a Medicare Advantage plan, with the exception that if you are brand new to Medicare and you take a Medicare Advantage right off the get-go, you have a 1-year trial right period where if at the end of the year you decided to go back and do a Medigap policy, you would be able to pick up one of those policies.
Okay, you are a wealth of knowledge, sir.
I do my very best.
We sure appreciate you. Thank you for that call, Ethelyn of Kansas. And that leaves a line open for you tonight, 877-283-7570. I understand there's an online event that can help.
There is, and Ethelyn was talking a lot about Medicare Advantage, for example, and we're seeing all these ads right now trying to get people to purchase their Advantage plans. And the key really is getting unbiased advice. And so AARP does have a great event coming up that I do want to highlight, which is called Maximizing Your Medicare Choices. And this event is Tuesday, October 24th. And it's an online event at 7 p.m. Eastern. And if you're enrolled, this is a chance to maximize your coverage and possibly save money. So I'm urging people to go to learn.aarp.org to figure out how to enroll in this event and get on this event, because again, it is unbiased advice. The other thing I would also recommend is if you're considering an Advantage plan versus traditional Medicare, I would say don't put all your faith in the advertising, put your faith in the SHIP person who can really offer you, again, that unbiased advice. Call Ryan, call his buddies at SHIP, because they can really help you, walk you through that and see if the plan is right. Maybe it is the right plan for you. Who knows, right? But just be careful what you see on TV.
Well, they can also tell you as well if what you need may require a supplement, or where you can go to look for a supplement. And so I love that. I love that SHIP is available out there, and that we have one of the representatives right here tonight answering our viewers' calls. Thank you so much for what you're doing for us. Okay, we're going to pause for a quick break. We still have time to hear from you tonight, 877-283-7570, and we still have coolers to give away as well, so you could be a winner. Give us a call. Let us know what questions you have about Medicare, as we are now in open enrollment. Started October 15, last through December 7th. I know there are a lot of questions out there. This is a once-in-a-lifetime opportunity for some of you. Get those calls in. We'll be right back with more Rural America Live with AARP right after this.
What are some of the biggest Social Security myths? I've heard that when you pay Social Security taxes, Uncle Sam puts that money in an account under your name. When you retire, you get your money back with interest.
That's wrong. Social Security is a pay-as-you-go system. If you paid Social Security taxes during your career, they helped cover benefits for your retired parents and their generation. People working now are paying for current retirees.
Got it. Here's another question. A friend told me that the best retirement strategy is to take your reduced Social Security payments at age 62. Because if I wait to get a larger benefit, but then I die, I'll miss out on all that money. Is that good advice?
It's true that some people die between 62 and the ages when you can claim your full or maximum retirement benefit, but most don't. The average American who reaches age 62 will live another 20 years or more. If you're in poor health or have a family history of early death, taking your benefits early might be a good idea. But for most people, it pays to wait.
Good to know. I hope there's enough money left for me to collect. I hear a lot about Social Security going bankrupt.
That's a myth. But Social Security does need to be updated. Right now, the system has a big surplus, but the reserve is expected to run out by the 2030s because the retiree population is growing faster than the workforce that's paying into Social Security. Even if that happens, it will continue to pay benefits because workers will still be contributing payroll taxes. But benefits would be lower unless Congress acts to make the system stable for the long run. To learn more, go to aarp.org/Social Security.
Welcome back. We are so glad you're with us tonight. We are really uncovering Medicare in a very timely fashion as open enrollment started October 15th. It will last until December 7th. A lot of people have questions, and this is your opportunity to get those questions answered live. And you might just be a winner if you do so. The number to call is 877-283-7570. We're going to go back to the phones in just a moment. We're getting a lot of calls, it seems, from people wanting to know how they can contact their SHIP or variant of SHIP, whatever it's tantamount to SHIP in their state looks like. How can people do that?
Yeah, so they can go to shiphelp.org. Or, certainly if you call your state office, your AARP office in your state, we can help you get in touch with your local SHIP office or your local area agency on aging. That's another great place to call. So in Minnesota, that would be the senior linkage line. Every state's got them, and you could also go to aarp.org/AARP Live, and we will make sure we have links on our page so that you can find those numbers in your state easily.
Yeah, I think the one that you're looking for is aarp.org/benefits, and that will take you to where you can find your local SHIP or something like it.
But if someone is looking for a phone number right now, Tennessee has volunteered, right, to direct them. So what is, Ryan, grab a pen. What is the number if you're looking for a phone number today?
That is 1-877-801 888-838-0044.
All right, State of Tennessee doing a
Stepping
service
up.
for the entire nation. We appreciate that. We are going to go to Virginia where David joins us. Thanks for joining us, David. What is your question tonight?
Yes, I have a question concerning Part D. I'm not currently eligible for benefits. I'm only 60. But I've been told that if you do not select Part D for prescription drugs when you are eligible, then you can no longer select that later down the road. Is that necessarily true?
David, that is quasi-true. You would have to wait until your open enrollment period each year, that is October the 15th through December the 7th, to select a plan for the following year. One of the things that you did not mention, but I will also tell you, is that you would potentially pay a late enrollment penalty, and that is 1% for every month that you go without coverage.
Wow. Well, thank you so much for that call. That leaves a line open for you tonight. We want to hear from you, 877-283-7570. Another question we're getting is, I originally refused Medicare Part B when I turned 65. Can I enroll now? Is it the same situation there?
There is a similar situation. If you are employed and receiving consecutive insurance coverage through your employer, you're not subject to any late enrollment penalty. Once you retire, you can contact Social Security and get signed up at that time. If you choose not to take that and you have not met those two requirements, you would need to wait until the general enrollment period each year, which I believe at this point is January the 1st through March the 31st of each year. Then you would get enrolled at that point. But you would have to pay a late enrollment penalty of 10% for every 12 months that you go without coverage potentially. And both of those late enrollment penalties last the remainder of your life. For prescription drug plan, it lasts the remainder of your life. For A and B, that would last 2 years long, double the amount of time that you went without coverage.
That's why it's important. What Ryan told us before was about 3 months before you turn 65, contact Social Security. If you're still working, and we know that people are working well into their 70s and beyond, so you might not be ready for it at that point, but 3 months before you turn 65, call Social Security, tell them your intent to either sign up for Medicare or not, and that way you're in the system and they know.
If you have friends or family members who are nearing that 65-year birthday, you want to make sure that they know as well. We all need to be looking out for each other in this, because that just seems unfair. I'm going to be honest. That doesn't seem right.
Well, my recommendation is always as well, if you feel like you do not need a Medicare plan, please contact us and let us do comparisons. There are plans out there that have $0 premiums that will not cost you any additional cost. You can get your coverage and not incur those late enrollment penalties. Okay, well, at least you're transparent about everything. I really appreciate that tonight. 877-283-7570. David, or actually, we're going back to Minnesota. Tammy's joining us from your home state tonight, Kathy. Tammy, thanks for joining us. Go right ahead.
Hi, my husband is 65. He turned 65 in July, and I'm quite a bit younger than him, and I'm still employed. My husband is on Social Security disability because he has a rare form of blood cancer. He's in the doctor's office a lot, and just his prescription per month costs about $15,565 a month. I need to know, and I've called Social Security, I called Medicare. I'm still employed, so he is covered under my insurance as primary and Medicare as secondary because of the disability. And now that he's 65, I need to know, would it be more cost effective for me to have him on Medicare and like a Medigap insurance instead of medical or Advantage? I get all these terms mixed up, but would it be better for me to cover him and where I still am employed or not?
Well, that gets into a very interesting situation because Medigap policies do not cover prescription drug plans. So what my recommendation would be is that you do a comparison, call your local SHIP office and do that comparison. You will find out if that would be more affordable, compare it against what you currently have with your employer. If you've already contacted Social Security and found that you were not eligible for extra help, talk to your SHIP office about pharmaceutical assistance programs and see if they can look up a program that may pay for those expensive drugs.
Well, and Tammy, one of the things she talks about is that donut hole, frankly, that Kathy mentioned, and some of these insane costs of these prescription drugs. And so that out-of-pocket cap that was in the Inflation Reduction Act that takes place in 2025 is going to be a lifesaver for people, because they will only pay $2,000, and that will be the most that they will pay for prescription drugs coming 2025, and it's because of the Inflation Reduction Act, which AARP fought so hard to get passed and signed into law.
Yeah, and I just want to share for Tammy specifically, because in Minnesota, I encourage you to call the Senior Linkage Line. They have unbiased Medicare counselors. That's who runs our SHIP program in Minnesota, so call them. We also have a number of one-on-one Medicare counseling sessions that we're holding at the AARP Information Center at the Mall of America, and we'll be doing those through open enrollment. So if you can't get in with the Senior Linkage Line, please call the Minnesota State office, and we will make sure we get you in touch with one of our Medicare counselors that will be at the Mall of America.
I love the fact that you're able to help someone like Tammy who's calling in tonight. And Tammy now has a feeling of, maybe I'm going to be able to get this $12,000 a month bill down. So thank you, AARP, for what you're doing. We're going to go to Melvin. He's in Illinois, Eastern Corn Belt. Thanks for joining us, Melvin. Go right ahead.
Yes, ma'am. Thanks for taking my call. I'd like everyone watching to be aware that there is a deductible with Medicare, not just the co-insurance, the 80/20 on Part B, but Part A, there's a co-insurance there every 90 days from the date of admission. And also they need to know, I'm losing my point now. There's when you go with Medicare Advantage program, they need to know whether it's Medigap or an Advantage. They need to know that there's a deductible up front, and is it low, is it high? There's a co-insurance at the end, and then what's total out of pocket? Some of them will come up and say, well, it's got a $3,000 deductible and a $3,000 co-insurance. Well, that's $6,000 out of pocket, not counting Medicare. I just want them aware of that.
Yeah, we have smart callers to point that out. And that's where some of that special help comes in, and some of those programs that might be able to help with your deductible, your co-insurance, or your co-payment.
Those Medicare savings programs, that we talked about at the top of the show.
Melvin's a winner, so congratulations. Hey. Thank you for sharing that information. Gary is our next caller. Thanks for joining us, Gary. Go right ahead.
Oh, yes. My question is, I just turned 65, and I am getting all kinds of insurance deals through the mail and stuff like that. And I'm wondering, who do I contact to get the best coverage for me?
Mm-hmm. Well, Gary, I will tell you, as I've been saying for the last probably 30 or 40 minutes now, call your local SHIP department. We're free, unbiased. It's what I always tell people within our state is I don't lose any money or gain any money based off of anybody. I am here to help you take control of your insurance and to understand what it is that you're going to have to pay for the following year. I'm not here to sell you anything. I'm here to empower you to have more confidence in your insurance, because it's a lot of information. Who has time to read through all of that? Go talk to somebody who has your interest at heart. I don't represent any company. I represent you, the individual, the Medicare beneficiary.
I will say, though, you have your big book, but we have our AARP bulletin. So for those that got the bulletin in the mail this month, we summarize what's in that book, and we can help. It's the Cliff Notes version.
I like that version better.
But I do encourage you to take a look at this because there is really, really important information. Because especially if you're turning 65, I can only imagine how much he's getting bombarded with advertising at this point, because of course everyone wants his business, right? And so the AARP Bulletin this month walks you through how to make these decisions and offers resources as you're making them on what kind of the best fit is for you.
And in fact, a friend of mine who just turned 50 texted me out of the blue, unsolicited, that was the best explanation of Medicare and Medicare Advantage that she'd ever read. So
right
there
here.
you go.
Wow.
If someone wants this, can they get this at aarp.org/AARP Live? They can.
You certainly can.
Okay, and you can download it, you can read it. What if someone wanted to have it mailed, if someone prefers that method of delivery?
Well, so this is free with membership. So anyone who's a member gets this every month, plus the magazine. So
I will also say we get extra copies at the state offices. So
okay, great.
You can also call your state AARP office. We have one in all 53 states, so all 50 states plus DC, Puerto Rico, and the Virgin Islands. So give your state office a call and say, hey, I'm not a member, but I'd really love to have that copy. Would you please send me one? And we can make that happen.
And that's a lot less time than trying to read through
400 some odd pages. Yeah.
Ryan reads it so you don't have to.
Yes, I read it so nobody has to.
Well, I really appreciate the knowledge that the best part about AARP is that you're sharing education. You're improving the quality of life through education, and you're helping us become better educated to look out for ourselves and become better advocates. Let's get your final thoughts for our viewers tonight, Ryan.
Everyone, Medicare is a difficult subject. It's a subject that we all eventually come to. There is a program out there that can be helpful to y'all. I do encourage everybody to please, even if you're confident on what you would like to go with, just call, get a check-in from your SHIP department. I do appreciate AARP having me and for all their advocacy that they do for the aging population. Aging is incredibly important in our country, and I would love to see us be able to do far more for them for many years to come.
Absolutely. And how long would a conversation typically last? If someone is listening right now and they think, okay, I'm needing to hop on the phone and have this conversation, how much time are you going to take with an individual?
I would say anywhere from 5 to 30 minutes. If I was doing a full comparison of all your options on Medicare, 20 to 30 minutes.
Okay, and that is something that's going to set you up for the rest of your life potentially.
Potentially.
It's incredibly important. What are your final thoughts for us tonight, Kathy?
Yeah, so be a good consumer. Do your homework and do your research. Take the time to call your SHIP. And, of course, AARP has lots of resources to help you do that. And a great place to start is aarp.org/Medicare. Lots of information to make sure you're getting the most out of your benefits.
Okay, Brad.
Well, bringing up the rear here, I think, first of all, all the things that we've mentioned about SHIP I just want to thank SHIP for everything they do. They've got terrific volunteers and they work really hard. So thank you for that. As far as some of the other benefits that we kind of touched on a little bit, sign up for your socialsecurity.gov account. So ssa.gov. And what that does, it allows you to have better information for when should I retire, right? And so should I retire at 67? Should I wait till 70? Should I maybe do it earlier? SSA.gov walks you through all those options. Also, Medicare.gov, as we've talked about, offers a lot of information. So, but as I said at the beginning, if you're wondering, am I eligible for SNAP? Am I eligible for LIHEAP? Am I eligible for extra help? That incredibly important prescription drug program that we talked about. You can find those answers at aarp.org/AARP Live. If you can just click on the links that we offer and check your eligibility, because you could be leaving thousands of dollars on the table.
And you can download the bulletin as well. The best explanation of Medicare, according to your friend Kathy. I love hearing that, your 50-year-old friend. Yes. Well, that about does it for us tonight. I want to thank you so much for joining us. Be sure to join us next month, November 17th, when former fraud investigator Doug Shadell is going to join us. We always love having him on to talk about the latest holiday scams. Thank you for joining us. We'll see you next time.